வாய்ஸ் வரல.
வர
கார்த்திகேயன் சார்,
ஓ எஸ்
வாய்ஸ் வரல. நோ ஆடியோ.
இந்த வர எஸ் வெயிட் a minute. இப்போ சார் ஆகுதா?
இல்லைங்க.
சார் ஸ்டாப் ஷேர் கொடுத்துட்டு மறுபடியும் ஷேர் பண்ணுங்க.
அந்த சிங்கிள் டூல் சார் வந்துட்டாங்களா? சேது
ஸ்பெல் பண்ணுங்க சார்.
SENG
இல்ல சார்.
ஆடியோ வருதா சார்?
இல்ல, நோ ஆடியோ.
வீடியோ வரலையா?
நோ.
New share. Whenever you go for a video share, go for new share, sir. And also you can go to the more, select share computer support.
ஷேரிங் சரிங்களா? Yeah, sir, Valan Murugan sir, yes, he has come. Yes, sir. Sir, shall we start, sir?
You can start.
Yes. Thank you. Thank you, sir. Thank you, sir. Good afternoon, one and all who are presented here. Annamalai University, Department of Physical Education, International webinar on recent advancement in research. It is a 3 days program. 29, it was started yesterday, 29/6/2020. Up to tomorrow, it will be there. So I am the organizing secretary, Dr.Karthikeyan, associate professor, and Dr. S. Arul is a co-organizing secretary, and our most beloved professor and head, professor director, Dr. P.V. Selvam sir is convener of this seminar. So today, there are two research persons who are going to deliver the topic. Dr. M. Sengutuvelan sir from the USA and Mrs. Vijaya Sidilkumar ma'am from Oman. And they are going to deliver with the topic impact of physical and mental well-being on curing coronavirus by Dr. M. Sengutuvelan and a foundation of movement for sports by Mrs. Vijaya Sidilkumar from Oman. So with these words, I would like to call Dr. S. Harul, Associate Professor and Co-Organizing Secretary of this international webinar to deliver the welcome address.
Thank you, sir. Karthikeyan, sir.
Yeah, please.
Okay. A very good afternoon, everyone. I feel happy and proud to deliver welcome address for this second day international webinar on recent advancement in research, built with intent to developing next stage in research, organized by Department of Physical Education, Annamalai University. I feel proud to welcome our professor and director, Department of Physical Education, Annamalai University, and convener of this webinar, Dr. P.V. Selvam sir. It is a great pleasure for me to welcome our eminent resource person, Dr. M. Sengutuvelan from USA. He is very much interested towards research on immuno-oncology and neuroimmunology related to central nervous system and immunity. A very good personality. He is going to present the topic impact of physical and mental well-being on curing coronavirus. This is a subject in which we should all be deeply interested because now we are in the pandemic period. And also, I extend a very warm welcome to our energetic resource person, a sports physiotherapist, musculoskeletal and sports injury specialist, Mrs. Vijaya Sandilkumar, ma'am from Oman. She is going to speak about foundation of movements for sports, a very attractive topic. Thank you, ma'am. And also, I would like to welcome all the participants for this webinar. Thank you, sir. I wish all the very best. Thank you for giving this opportunity. Thank you, Karthikeyan, sir.
Webinar. And now I want to introduce our today's resource person, Dr. Sengutuvelan Murugan, Associate Scientist, Department of Animal Science, Rutgers University, New Jersey. And he is going to deliver with the topic of impact of physical and mental well-being on curing coronavirus. And as far as Sengutuvelan Murugan sir is concerned, he earned his PhD in biochemistry from Annamalai University, India. So we are so proud of you, Dr. Sengutuvelan Murugan. You are a great alumnus of our university. And after his PhD, he received a postdoctoral fellowship award from Japanese government prestigious Japan Society for the Promotion of Science, JSPS, and Hakata University in Japan. In 2009, he moved to United States to pursue his career in cancer research. Since then, he is working on several cancer research programs at premier institutes such as the University of Pennsylvania, Rutgers University in New Jersey. In US, he received prestigious awards such as Gallo Award for outstanding cancer research. Also, Dr. Sengathivalan Murugan is an elected member of American Association of Cancer Research, AACR, and American Association of Immunologists, AAI. Throughout Dr. Sengathivalan Murugan's many years of cancer research, he has given countless presentations at scientific meetings, seminars, and conferences in many countries, including India, Japan, and in United States too. He has published more than 30 research articles in peer-reviewed journals, including Cancer Discovery, Clinical Cancer Research, Carcinogenesis, Cancer Research, Glycobiology, Journal of Immunology, and Journal of Biological Chemistry, with more than 5 collaborators from different nations, 25 research abstract and invited reviews he has pitched, and 3 books and chapters he has written. And Dr. Murugan is serving as editorial boards of several journals, including Scientific Reports, Pharmaceutical Biology, International Journal of Cancer Research, International Journal of Pharmacology, Trends in Medical Research, Cancer Research and Management, and an editorial board member of International Journal of Nutrition, Pharmacology, and Neurological Sciences. His primary research interests lie in the area of immuno-oncology and neuroimmunology, along with cancer chemotherapeutics. He has been particularly interested in studying signaling pathways that are associated with cancer development, progression, metastasis, and resistance. Most recently, his focus is on investigating and developing novel approaches for the treatment of various variety of cancer, including breast, melanoma, and lung in preclinical models, and translate discoveries into effective therapies for patients. So I left out something about Dr. Sengathivalan because of the time is concerned. So with this introduction, I am so honored to welcome today's resource person, Dr. Sengathivalan Murugan sir, to deliver his topic. On behalf of the organized committee, I am inviting you, sir. Please.
It's my pleasure to be here for this international seminar. Since I'm alumni from Annamalai University, I'm very happy, and then very happy to see our university and university people. So I want to initially thank Dr. Selvam, Professor Director and Convener of Physical Education, and the organizer, Dr. Karthikeyan, Associate Professor, and Dr. Arul, Associate Professor and Co-Organizing Secretary of this department. So it's my pleasure to be here, and I want to mention that I want to thank Dr. Muhammad Isa. Like he was the one who introduced me to this seminar series. So I'm very excited to give a talk about how coronavirus is impacting our life throughout the globe. So, and I want to before we go into the detail of how physical and mental well-being is very helpful to cure the coronavirus and for the well-being of the human populations. So before that, I would like to give some background about virus. So since this is the first seminar about uh, coronavirus, so I would like to give a little bit introduction about the virus and how the virus are classified and all those things. So let me go and share the screen. All right. So let's get started. So the how the physical and mental health is helping to cure the coronavirus. So before that, we will start with the introduction about the virus. So virus, what is virus? So virus is a very small non-cellular parasitic organisms which cannot live by themselves, but it can live only in the host. So what is mean by host? So any animal, human, or other mosquitoes like that, they called as host. So which causes diseases. So and there is a lot of debate that whether virus is living or non-living. Even though the virus possesses gene, they can replicate, evolve, and they adopt based on the host and the biological niche. So they are considered as a non-living entities. So if the virus can go out of the host, it cannot live. So it is considered as a non-living infectious organism. So if you see this, the position of the virus in our whole the animal kingdom of life. So here, like the bacteria lay here, and then it the human. So when you see here, like the coronavirus are basically they are kind of branched from before the evaluation of the human. So so this is how virus sit in the kingdom of life. So and is it, that is a basic question, is it all the virus are bad? I say no, because some viruses are very useful for current and potent applications. For example, they are the source of certain enzymes. For example, reverse transcriptase, which are obtained from retrovirus, and there are some enzymes, RNA polymerase, which are derived from bacteriophages. Also, these viruses can be used as anti-cancer agents. For example, genetically modified virus, for example, herpes simplex virus, they used for treating the cancer. So what they do, they use the virus to infect a specific cancer cell without infecting the normal cells, and thereby they deliver the anti-cancer agents. So also these viral vectors are used for making vaccine and other um, protein products using the viral vector. So all the viruses are not bad. So, but if it is very lethal to human being and other host, it considered as a bad virus or lethal to the society. So considering the size of the virus, so imagine this is the typical human cell. When you consider the human cell, this is the size of the virus. So comparatively, it's very, very small. So for example, the polio virus, which is uh, 30 nanometer in size, whereas herpes virus is 200 nanometer. So when you see the virus size, it ranges from 220 to 300 nanometer. So you cannot see the virus through the eye, but microscope, even my light microscope, ordinary light microscope, we cannot use to see the virus. But you can use electron microscope and other methods to see the virus. So the size is very, very small, but the effect of virus is very vast. So considering the viral genome, so genome is nothing, the genetic material of the virus. Based on the type, there are different 3 types of classified DNA and RNA virus, and sometimes these virus can excuse me, these virus can use DNA or RNA based on the replication cycle. So the DNA can be a double stranded like this, and it can be a single stranded DNA. When you consider the RNA, it can be a double stranded or a single stranded. So in all the cases of the viral genome, it can be either only as a linear or circular. So when you see the classification of the virus genome based on the genome, so there are different kinds of classification. Whereas, so our main interest is on coronavirus. So the advantage of the coronavirus, like the virus itself, they have the advantage for themselves to infect the host, because they use single-stranded positive RNA, so which can make the mRNA directly and infect the host cell. So this virus, by evolution, have advantage of directly infecting the cells, host cells, and making the new virus very quickly compared to the other class of virus. So that is why coronavirus is more having more advantage than the other virus to replicate. So when you see the shapes and sizes of the viral particle, there are different types of virus. For example, DNA virus, they are non-enveloped or enveloped. So what is enveloped means there are different proteins which are present on the surface of the virus. So same thing here in the RNA virus, non-enveloped and enveloped. When you see the coronavirus, you can see this is the structure of the coronavirus. You can see the envelope and a lot of proteins on that. So so how these virus transmit between the host. So there are various, basically 2 types of transmission, one through the non-vector transmission and the other through the vector transmission. For example, cold virus, influenza virus, they all transmit through the horizontal transmission, like through the respiratory tract and the intestine or any wound like that. So these are the examples. Whereas vertical transmission means, so from the same host, it will transmit to the other host. For example, from the mother to the child, which is inside the fetus. So, for example, rubella virus. So the other mode is vector transmission. Vector is a intermediate host. For example, a mosquito is an intermediate living vector where the virus can go into the mosquito and then cause to the viral transmission to the other host, for example, to the human. So the other mode is inanimate vectors. So for example, syringes and needles, if they get contaminated with the virus, it can be act as a host, intermediate host to transmit the virus to the other host. For example, hepatitis B virus, which mainly transmit through the syringe. So what when you see the coronavirus structure of the coronavirus, so it belongs to the coronaviridae, and this is has the genome plus standard RNA virus, and the name came from the Latin word corona. It's like crown like, so this looks like a crown, so they named as a crown like or coronavirus. So there are various proteins. For example, you see this spikes, which called as spikes protein. So this is the protein which help to bind the virus to the host. And there are several proteins like membrane protein or nucleocapsid proteins which protect the genome of the virus. Also, they have the lipid bilayer. So this virus have a, as I said before, like this virus have a great advantage in infecting the host by having the um, extra protection like of the mRNA, like 5' and 3' cap. So to as soon as enter the host, it start the infection cycle. So this has various advantage. So when we have a question like where the coronaviruses are found, so coronavirus are everywhere. It's not only new. So you can see they found in cats, dog, pigs, and everywhere. Bats. So the bats are responsible for the SARS coronavirus and the COVID-19 transmission. So now they suspect the other host, the pangolins. Pangolin, it's like a anteater, which many of you have seen it. So as well as in humans. So is the high, how many coronavirus have been found so far? So until the SARS coronavirus epidemic in 2013, there were only 19 coronavirus were found, 2 in human and 13 in mammal and 4 in avian. But after this epidemic, the scientists and doctors, they made a good progression by discovering more additional another 20 coronavirus in the 3 in human and 11 in mammalian and 6 in avian. So the coronavirus is not new to this world. So how does the COVID name it got? So when you see the name, it's abbreviated coronavirus infectious disease 2019. So it's have other name as well, COVID-19 Wuhan virus or novel COVID coronavirus 2019 or SARS coronavirus 2. So it's called severe acute respiratory syndrome coronavirus. So it is heavily believed that Wuhan, China is the origin of the virus in December 2009. So when you have a question like this, like what is epidemic and what is pandemic? So epidemic means the infection spreads rapidly to large number of people in a given population within a short period. So for example, in Chennai, it is spreading very fast with large number of people in the given population. So what is pandemic? So means the disease outbreak that spread across the countries and continents. Now, when the viral infection started in China, it started as an epidemic, whereas now it is considered as a pandemic. So it spread all over the continent. So there are a lot of conspiracy theories about the origin of COVID-19 virus. So one of the conspiracy theory is it started from a research institute called Wuhan Institute of Virology. So they believe that they were using bats in the laboratory, and then they injected the virus to study the viral nature of the virus. Somehow the bat with virus escaped from the research institute, and it went into the public. And when the bat went to the wet market, it infected the pangolin. It's called anteater, and somehow people are eating bat, pangolins, and everything. If they are not cooked well, or their blood get into the human, it causes the viral transmission. So scientists believe that this is how the virus started from China. So now it started as epidemic, and now it is um, around the globe. So now it is a pandemic. So unfortunately, so when you see the number of cases throughout the globe, India is in the 4th position. So far, as far as the update, so there are so many coronavirus cases. Every day there is increasing number of cases throughout the globe. So it's very unfortunate that India is leading the race, but I believe that somehow the government and then people will help to stop the virus, or stop the spreading of the virus. So as I said before, as you can see the structure of the virus, so they have a lot of spike proteins, and which help them to bind to the host cell. So this is the genome of the viral. So let's go to the how the virus or effect of the virus can be controlled. So there are different methods. So one is the main is the vaccine, and another is the antiviral drug. And also the host immunity is very much important for controlling the effect of virus within a host. So there are basically 2 types of host immunity: innate immunity and then acquired immunity. So how the host immunity can be increased against these virus or any infectious disease. So it is mainly through the health and wellness. So when you define the health, so there are there are 8 dimensions health. So physical health. So health is the ability to the body function daily with energy and to respond to the emergency. So it is come through the physical fitness. So and the next one is social health. So how the ability to interact with the people and the environment, to have a satisfactory interpersonal skill. So and the next one is the mental health. So mental health is mainly the ability to learn, grow, and intellectually. And when we go to the emotional health, so this is mainly through control, have the ability to control the emotions so that you feel comfort expressing themselves appropriately. And the other aspect is the spiritual health. So if there is a belief in some unifying force, so that which varies from person to person, but the faith of feeling connected to humans and other believing in one's life, purpose and meaning. So also environmental health is very much important for the well-being of the any individual. So environment, for example, getting the pure quality of water, and you need to have the right amount of noise and amount of various aspects um, they very much needed for the environmental health. For example, occupational health. So how you are satisfied with your job, and are you doing a meaningful work and helping, are you contributing the your health and your occupation for the health of the others. So the most important, financial health, which includes that amount of savings do you have, how much your income and expenses, etc. So these are the 8 dimensions of the health. So what is wellness? So wellness is a degree of balance that you make from these health. So for example, so this is a kind of balance. So it's depend, the wellness is basically how you manage all these health aspects in your life. So if any imbalance happen in any of these health, your wellness will goes down or up. So so the next question is, which one is more important, physical or mental health? I would say both, because there is a saying that, you know, without a sound mind, one cannot have a good physical, or without a sound physical, one cannot have a good mind. So physical health and mental health are heavily interconnected, and if one goes down, then the other will get affected. So both physical and mental health is very important. So how the physical and mental health is get affected? So these days lot of um, people are talking about stress, right? So the combination, what is stress? So the combination of stressors, or in other words, it's a stimulus or stress reactivity. So that is the effect of the stress and the consequence, which is called as a strain. So combination of all these stressors, which causes the flight response, and the stress reactivity. For example, it increases the muscle tension and blood pressure, which gives a physical, psychological, and behavioral consequences. So these all are considered as a stress. So when you see in a society, what are the most common causes of stress in our society? As you can see, money, money is the sitting in the top. Uh, the relationship, family responsibility, also significant part of the stress are caused by personal health and the family health problem. So so it's very much important to have a physical and mental health to avoid the stress or to reduce the stress. So what are all the effects of stress? So there are so many effects: headache, upset of the stomach, muscular tension, and another main main effect of the stress is the immune dysfunction. What is immune dysfunction? So when the immunity of the host goes down, the immune, it causes the immune dysfunction. So for example, so immune, how the immune reactions or immune cells are controlled. So it is a combination of 3 key system in our body. So for example, in acute stress, so for example, somebody get frightened, so they get acute stress, but that will go away very fast. And whereas the chronic stress, for example, if somebody lost their job or various, for reasons, they will have chronic stress. That means they will have a stress for a long time, which affect the immune cells. so mind, endocrine system, that is the hormone secreting system in our body, and also the immune cells, for example, tonsils, lymph nodes, spleen, these are all considered as a immune organs. So you can see here, like physical and emotional stress affect the brain, and if it affect the endocrine cells, which is in this system, and it affect the immune cells. So when the immune cells get affected, they can get easily affected by the pathogens. So it's a combination of neuroendocrine and immune interaction. So how so what are the components of the immune system? So when you do a blood test, you can see a lot of they mention is leukocytes, for example, the white blood cells. They classified into 5 types: neutrophils, eosinophils, basophils, and lymphocytes. So lymphocytes are the major white blood cells, which helps to control the immune, the pathogen attack. For example, NK cells. NK cells are natural killer cells, and the T cells. So these are the two major types of immune cells which help to um, control the different types of pathogen attack. So, for example, in our research, we do a restrained stress. So we artificially create the stress to the animals. For example, in the rat, to see how the psychological and immune system get affected. So we put the rat inside the closed chamber, um, and we analyze the effect of the restrained stress, which is quite similar to uh, what we are doing now. So you stay at home. It's a kind of restraint to humans. So I can see that lot of people get depression. So the depression goes up, and then anxiety goes up. So when these two get increased, then definitely the immune cells or the immunity goes down. So which is kind of restrained to the human community right now. But when you how to overcome this? So how much exercise is good for our health? So as you can see, there is a study which appeared in the International Journal of Sports Medicine. As you can see that it is a J-shaped curve. So they compared the the people from sedentary life, moderate exercise people, and high exercise people, the intensity of the training volume. So you can see that sedentary people have very high levels of risk. URTI means upper respiratory tract infection, and there is a correlation between the upper respiratory tract infection and the exercise. Whereas you can see the moderate exercising people, the risk of the infection is very low. Interestingly, in the high exercising, like heavily exercising people have high risk of respiratory tract infection. So, so there are several studies showing that this heavily exercising people have a lot of stress, mentally as well as the physiologically. There are they causes stress. For example, a hormone called cortisol, which increases during the heavy exercise, that reduce the immune function. So in this journal, they compared, in this study, they compared the athletes with the versus non-athletes. So so the athlete believed that 70% of 76% of the people, they have a less vulnerability to the illness than the non-athletes. Also 68% of the people, they think that they had a much better life than the sedentary friend. Also, 90% of them agreed that they rarely get sick. So when you see this graph, so this is the day with the symptoms of the upper respiratory tract infection. So this is the exercise group and this is the control. So as you can see, almost half of the people from the exercise group have recovered from the infection very fast compared to the control. So it shows that exercise, moderate exercise is helping them to get out of the infection very fast. So what happens to the immune system? So they compared the exercisers and non-exerciser. So this is the functional unit. For example, the natural killer cells activity and the lymphocytes, that is the T cells proliferation. These are the two measure that can measure the function of the immune system. So considering highly conditional people and the sedentary people, so you can see the function of the NK cells and the lymphocytes goes down in the sedentary people compared to the highly conditioned, that is moderately exercising people. So then they compared the which kind of exercise is better. For example, the walkers versus the gymnastic exerciser. So as you can see, there is not much different, but the gymnastic people, they have more the the weeks of training. They compared the weeks of training and the NK cell activity. So they found that they compared the between these exercising people and also compared the from the control, which is considered as a zero. So during the weeks of training, the gymnastic people have more immune function. So in terms of NK cell activity and the lymphocyte proliferation. So moderate. So they conclude that moderate exercise is very good for boosting up the immunity. Also, whether they also compared whether just the diet or exercise, or just exercise and diet, which one is good. So they did the diet only, and this is when you compare the week 0, there is no much change in the diet only and the diet and exercise. Whereas after the 8 weeks of training, you can see that diet and exercise people have more immune cells when compared to the diet alone. So that means the diet, good proper diet with all the vitamins, minerals, and moderate exercise is good for boosting of the immune system. Also, they compared young versus old people in terms of immune cells. As you can see, the various types of immune cells they compared. This is compared to the pre-exercise. So as obviously you can see that young people have more immune cells than the old people. So so with that, we will come to the end, how the exercise helps to boost your immunity. So there are other ways to boost the immunity during this viral pandemic. So that is the vaccine. So there are different methods of vaccine production, but we are not going to see in detail, but just I will explain one or two. So there are, for example, in this case, the inactivated virus, they For example, they take the virus and they inactivating certain proteins on the surface, and they use that virus to inject into the animal or humans to produce the antibodies against the virus. So the other type is a fractionation. So they fraction these proteins, and then they use the subunit of the protein and they inject into the host to make antibodies. So these are the um, main methods of vaccine production. So you might have heard that lot of news about herd immunity. So people still believing that, you know, um, if the herd immunity helps to protect the transmission of the disease. So what is herd immunity? So herd immunity means that immunity of the whole population. For example, in Chennai, if the people, for example, if Chennai has 14 million people, then maybe 10 million people would get the immunity, and which protects the spread transmission of the disease to the unvaccinated individuals. So you cannot vaccinate all the throughout the population within a short period. Uh, so there the herd immunity plays a major role. So which one is very important? Whether it's a individual immunity of individuals or the herd immunity. But I would say herd immunity is more important than individual immunity. So when the people get vaccine, so they will block the chain of transmission of the disease to the unvaccinated individuals. So hopefully we will have some vaccine soon, so that the people block the transmission. So when you go to the antiviral drugs, so there are various drugs which affect the various steps of the virus infection. For example, so the virus bind to the cell and enter into the human cell or any host, and they replicate and produce more virus into the host cell. So for example, uh, certain proteins which considered as antiviral drugs prevent the entry of the virus into the host cells. And other drugs which are nucleoside analogs, they even though the virus get into the cells, it can be used as a nucleoside analog to prevent the replication. So in the next slide, you can see that these are the various types of drugs which are used to for the HIV patients. So different drugs are classified in different types. Non-nucleosides inhibitor, protease inhibitor. So we don't want to go into that details, but so there are antiviral drugs. There are so many clinical trials are going throughout the world to see whether these antiviral drugs can be used for curing or stop the controlling the coronavirus. So since we talked about how the exercise and host immunity plays a major role in preventing or lessening the viral effect. So you can see the anatomical barriers. So this is the virus anatomical. The first defense is the anatomical barrier. So for example, your skin and or consider as anatomical barriers. So they stop most of the pathogens, and then if the virus goes into the body, first would come the intrinsics, that is the uh, innate NK cells like that. So even the virus escape from that. This is the innate immunity. And finally, when the acquired immunity, if the person get acquired immunity, So they will block most of the viral replication. So it's a very much important to have all these barrier host immunity. So this host immunity is very important for spreading of, for example, the virus. So in this figure, you can see that how the each immune cells kill the virus through the various mechanism. So host immunity is the major contributor for the controlling or reducing the effect of virus. So to improve the host immunity, the dieting and also exercising is, and mentally being good is one of the key factor for increasing the host immunity. So when we go to the target, what are the targets of the coronavirus? So primarily it affects the lungs, and the secondarily it affects liver, heart and kidney. So when you consider the symptoms, you can see that the starting point is the dry cough, and they get cold, fever and shortness of breath. So as you can see here, so the average days, non-symptomatic days, like day 1 to 3. So 80% of the patients within day 1 to day 3 have the non-symptomatic. So, and 14% of the infected people start showing the symptoms within 4 to 9 days. So basically mainly in the lungs, and 5% of the people get infected and they need to do intensive care. So which starts in 8 to 15 days. So at that point you can see that the virus present in the blood. So actually the by week 3 is the very crucial period for the infection, either to we should control or the patient is going to get sick more. So it's most of the deaths happened between the 15 and 22 days from the onset of symptoms. But people who are discharged from the um, infections, they varied from 18 to day 18 to 25. So we will see these symptoms in different population. So so how COVID-19 is different from other coronavirus. So this COVID-19 is causing lot of different types of reactions in the body. For example, they are causing blood clots. So they are clotting bloods in the leg, blood vessels of the leg, so which causes the deep vein thrombosis. Also it can make a clot in the lungs, so that the person cannot breathe. So these types of and causes the pulmonary embolism. So these kind of new reactions are triggered by this virus. So these kind of symptoms were not reported in any other coronavirus infection. So this is very unique to this virus. Also, it can causes blood clot in the vein, which goes to the brain. So as you can see that it can clot the blood and causes various paralysis symptoms to the patients. Also, now the reports are coming out that it causes a lot of massive heart attack sufferings, increase the palpitation and chest pain and discomfort. So these are all the major symptoms. New symptoms that are emerging by this coronavirus. So far, there are no specific or effective treatment were founded, but I would say that there are several ways to beat the coronavirus. So it's not a single person or only by the government or doctors should play the role, but it's all it's a collaborative effect. As you can see that everything is interlinked: government, researcher, doctors, patients, and mainly the public. They all have the um, um, ability, they all have the ability or responsibility to beat the coronavirus. So let's move on to the personal level protection and how we can help the community or help our family or help ourselves from getting infected. So one of the personal level prevention is by not touching your eyes, nose, or mouth using the unwashed hands. For example, if you scratch your eye, so in the eye, the eye cells are considered as a soft tissues. So these tissues have receptors for the entry of the virus. So the virus from your hand to touch goes into the host that is on your eye cells, which and it enter into the cells and it causes replication. So if you don't touch these soft tissues with the contaminated hand, then there is a way to prevent that. So other method is to wear a mask. How so you know these virus prevent the they spread through the droplets via coughing or sneezing. So as you can see that coughing or sneezing can cause the spread of droplets. So up to 4 meters, the droplets can actually travel. So this is the small droplets and this is the bigger droplets. So it's very important to cover your nose and mouth using any type of mask that prevents the spread of virus or block the virus. Also, it's very important how we sneeze and cough. So for example, the Western countries, they found the effective way of preventing the spread of virus or any infectious disease by the method of elbow sneezing. So basically you don't sneeze or cough openly. So you sneeze or cough in your elbow. That means when you have a shirt or any material that can absorb the sneeze, or you can use the paper towel and throw these paper towels into trash safely. But don't use your bare hands to sneeze or cough. So that spread the coronavirus particles into your hand. So when you touch the same hand in other places like doorknobs or some other place, it can get contaminated and other people get infected. So as you can see that how the sneeze during the particles droplets get spread out during the sneeze. So please aware of this and then try to not cough or sneeze to your bare hands. So use the other method like paper towel or the elbow sneezing. So other aspect, the personal level protection is wash your hands with soap. It doesn't need to be a specific type of soap, but any soap will help to disinfect the virus. So as you can see, this is the coronavirus and this is the genetic material. So these are the soap molecules. So what the soap molecule does, so it goes and bind to the viral membrane and break the viral protein and release the viral genome. So the once the viral genome get released outside, it cannot survive. So the soap molecules can surround the protein of the virus, thereby it form a micelle, and thereby it kills the viral. So this is a very basic mechanism by which you can prevent the by washing your hands. You can prevent 10% of the viral transmission. So also you can use any type of cleaners to clean like doorknobs, wherever you think that you touch the places like doorknobs or any boxes, for example. Also you can use the gloves. Not everybody can afford, but I would, whoever are in risk population, they can use gloves. Or you can when you go outside for buying groceries, you can use the gloves and then throw the disposable gloves in a safer way. For example, you can see if somebody have the virus and touch everywhere, and you can see the lot of viral particles sit there. It can stay up to in certain surfaces. You can see it survives up to 4 hours, and even in the refrigerator it can survive up to 96 hours. In the cardboard box, you can survive 24 hours. So so you can really make an impact to prevent the spread. So that is very important in this condition. Also, so you can increase your immunity, even though if you are staying outside, by avoiding more food and eating junk foods. Rather, you can eat healthy food and do lot of indoor activities like doing yoga and skipping and drinking healthy drinks, lemon juice or like that. So some people say that, how would I stay healthy inside the home? But you can do simple exercise or some other activities to keep your immunity in a higher level, so that you can, even if you get infection, it can be uh, resolved easily. So also it's very important, as per the government advice, you can use as safe distance or other method to prevent the virus. So please don't use the handshake or some other things. I know that you all aware of this, but just I thought just I would share this, remind you that these are the effective ways to prevent the spread of the virus. You can keep distancing, and whenever it is possible, make a video call or messaging, so that you will have communication with others, but in the same way you can prevent the spread of the virus. Also, it's very important, you should contribute to the society to protect the old and sick people during this COVID pandemic, because as you know that the older people and sick people have less immunity than the younger and non-sick people. So for example, in conditions like pre-existing diabetes condition, so they will have a lower immunity, so there will be a high risk for them to catch this virus. So whichever way you think that you can contribute to protect the people, so you can do that. So so when in terms of therapeutic, so there are more than 60 trials are going around the globe. So according to yesterday, there are good news that there are some vaccines against the virus is already in phase 2 stage. And as you know, this is the drug now. Everyone started using this as a drug for antiviral drug that controls or improve the condition of the patients. So it's a long way to go to get a vaccine, but till then we need to be safe, and then we need to be responsible to prevent the spread of the virus and protect our family and the society. So we cannot say that one person is responsible for to beat the COVID-19 crisis. So it's a collective effort. So I would say economy, healthcare workers, students, researchers, doctors, patients, and more importantly, the public. So public should contribute their responsibility to spread the virus. So so please encourage or advise the people, or you know, your near and dears to help to prevent the spread of the virus. So with that, so there are various way to stay calm, and there are various way to improve your immunity. As you all know that, since you are all from physical science, you know, you personally felt that how exercise and physical fitness is very much helpful for the well-being of the human society. So please contribute your responsibility to stop the virus spreading and protect you and your family. Stay safe, and then yeah. So with that, we come to the end of the presentations. So I thank you for this opportunity, and thank you everyone, the participants, for listening this talk. So if you have any questions, please ask me. I would like to answer them. Thank you so much.
Thank you so much, Dr. Mugan sir, for a wonderful speech. What a wonderful sessions we had, sir. Most informative sessions, sir.
Sorry?
Can you hear me?
Yeah.
Yes, sir. Thank you so much, sir. Thank you for your wonderful session.
Sure.
And all are worried about this COVID-19, even from the childhood. No, and they don't have an idea where it has started everything. But in the news channel, every day they are updating, but all are worried, whatever it is. But you have explained that COVID-19 from the origin itself, and it has given a very clear idea about COVID-19. So you explained also how the people are stressful and how to overcome that stress, everything, and the need of improving immunity. Also, you explained it very well manner and in detail with technical aspects. As you are oncologist, but you have explained is very nice. As he said, the method to conquer the COVID, we the public should have cooperate with the government and public, but the doctors and every way. So he explained in a very nice manner, and also he explained the personal level prevention methods also, and you have given a very clear idea about COVID-19 and how to overcome this COVID-19 physically and mentally. Moreover, you made so much of awareness, sir. Okay, thank you so
Thank
much.
you.
As an organizing secretary, I'm very thankful to you. Dear participants, if you have any doubt to ask with Dr. Sengatwalan Murugan sir, please post your question in the chat box. I opened it for you. Please. Don't post good morning, good evening, good afternoon. Please post your question only, because the resource persons, they are spending the precious time. Sir, what another one question from the participant? Can you able to see the
No, can
chat
you
box?
read?
Yeah. What should I do if a family member has symptom of coronavirus?
Sorry. Can you repeat it?
What should I do if a family member has
Okay.
symptom of coronavirus?
Yeah, so like many virus, like cold virus, they start symptoms like this. So for example, you common cold, it starts with a sore throat, like it gives a pain in the throat, and then you will have a running nose, right? So we cannot think that like all the symptoms are belongs to the COVID-19, but as I said in one of the slide, you will continuously, like the onset of the symptom will start in 3 days. Something once the person get infected, you can see that they get symptoms in day 3 or day 4. So the symptoms, first symptom would be the dry cough, and cold, like running nose is not a very unique situation in this coronavirus, but you will have fever, continuous fever for 3 or 4 days as soon as the symptoms started appearing, and then you will have headache, breathing difficulties. So those are the really worrying symptoms. So you don't necessarily think that all these symptoms are belongs to this coronavirus, but if you have these symptoms for more than 4 days, then definitely you need to get tested, like, yeah. So so one of the thing, like the non-symptomatic, so people will not have any symptoms, but still they have so they are the major threat to the society. So it is not their choice, but like they have such a body mechanism, so they have, that means they have the more immunity, they have the ability to control the virus in their body without showing any symptoms, but they can easily spread to the others, families and friends. So you need to be very careful with like those kind of people. So as the question arises, then those are the symptoms. So symptomatic patients are need to be very careful, especially the people have lower immunity or old people. So yeah, So as I
Yes.
said, like the symptoms starts from 3 or 4 days after the infection. So did I answer the question?
Yes, sir. Yeah, yeah. Fine, sir. Another a question from Dharmendra Kowal. Or
Mhm.
or asymptomatic patient are vulnerable in spreading disease more than symptomatic.
Yes. So yeah, as I said, asymptomatic people can easily transmit the viral to the people, common people. So that is one of the problem we are facing. So so that is how, like, so for that we don't have control, but uh, as soon as you started getting the symptoms which I mentioned, it is better to contact the local health department, or you can even if you have any family doctor, um, you can contact them by phone and say, or you can go to like video chat, and then you can tell them the symptoms so that they will better diagnose, rather than you judge yourself that you got infected, and you don't need to panic that. um, and regarding the recovery, so um, um, as far as now, um, so only few percentage of people are going in critical condition. So but as far as um, concerned of in India and Tamil Nadu, yeah, so only few percentage of people are going to ICU, but most of the people get cured in early stage. So uh, so the bottom line is, um, those who are in risk, like the older people, and they have some pre-existing diseases like diabetes, heart disease, they need to be very careful, and they need to get attention by the doctors before the virus spread heavily in their body.
Thank you. Thank you, sir. Sir, the last question, sir, because we are running out of the time. So, for 18 it has come. So, last question.
Yeah.
Dear sir, all the sports person normally they will have more immunity power than the normal person. And the question is, some
Mhm.
of the international cricket players also affected by COVID-19. How it is possible, sir?
Yeah, so it's not that, like sports person will not get the virus. So they will get the virus, everyone will get the virus. If even the asymptomatic people, they have the virus. So nobody can stop the virus getting into the body. But the asymptomatic people, they beat the virus without any symptoms. That means they have the more ability to defeat the virus. So as a sports person, maybe they will have better immunity than common people. Even though if they get the virus, they can easily get rid of the virus. So that is the major thing. So whereas if you panic, and then mentally depressed, or your anxiety goes up, then you will get more severe infection in um, so be calm, and nothing to worry about that. But the sports person will have, definitely will have a better immunity than the others. If if they don't have any pre-existing disease.
Thank you so much, sir.
Sure.
Sir, can you please stop the sharing the screen?
Yeah, sure.
Thank you so much, sir, for your wonderful session as a token of love, and also as an organizing secretary, I want to present this e-certificate to you. Please accept it, sir. This is
Thank
for
you.
your wonderful presentation, and also for the acceptance to give to deliver the your excellent topic. And we are all impressed with your topic. Thank you so much, sir.
Thank you. I will go offline just to, I will take
Please,
off
sir.
the.
Please, sir,
Thank you.
please. Thank you so much. Dear participants, I'm very happy to welcome the second session's resource person, Mrs. Vijaya Sindhu, Senior Physiotherapist, Armed Forces Hospital, Muscat, woman. She is having a 23 years as a clinical physiotherapist. Earlier, he served as a senior lecturer at Masters University College, Malaysia, and also she served as clinical tutor at RBS College of Physiotherapy, Coimbatore. She served as a physiotherapist at the Scindia Ortho Hospital, Pollachi also. And she is having a responsibility for safe and competent assessment, valuation, interpretation, diagnosis, and prescription of suitable treatment, rehabilitation protocols for the patients with the musculoskeletal sports injuries. And she has given a very, very brief biodata for us. And with this introduction, we are very happy to welcome Mrs. Vijaya Sindhu Kumar, Senior Physiotherapist, Armed Forces Hospital, Muscat, to deliver the topic with foundations of movement for sports. Ma'am, please. You can unmute your audio, ma'am. Yeah.
Happy evening, sir.
Thank you.
Shall I start, sir?
Please, ma'am, please.
Okay. I first of all thank Dr. Selvam, Dr. Karthikeyan, and Dr. Arul, and to Dr. Isa for making me participate in this webinar of recent advance in research. So it's so happy, and I am even excited to be into the sports community, to be a physiotherapist who is a sports physiotherapist. I'm so happy, and I would like to start my presentation. I welcome all the participants for sports rehabilitation webinar, and sir, you can hear me, isn't it?
Yeah.
Yes.
You can hear. Please start sharing your screen.
You could see the screen, right, sir?
No, ma'am, not it.
No. Just a minute. Let me see my screen, it seems.
This I want to give a small information to all the participants. Please don't ask any feedback link. I will send the feedback link to your mail. I'm not going to share any feedback link here. Okay, I'm going to share the feedback link to your registered mail ID, because you have entered with a registered mail. You are all, so don't worry.
I cannot see my screen, it seems.
I will send the feedback link by evening to all your email
I
ID.
can hear. Sir, can you see my screen now?
Yeah, of course, but not. I can see your video, ma'am, but not. You have not shared any screen.
Not share the screen. Just a moment, sir.
Yeah, please, no problem.
Yeah.
Yes, ma'am. Yes, ma'am.
Okay.
It is coming. It's coming.
Okay.
Yeah, you make it a slide show, please.
Yes. Is it okay now?
Yes, ma'am. Yes, ma'am.
Okay. So I would like, before starting my presentation, I would like to share my experiences as a clinical sports therapist working in a hospital setup with a sports rehabilitation unit. Here, actually, why I wanted to share this is because more of the populations of the players which I come across are injured players, So I would like all physical educators, the physical instructors and the trainers to just go through all these things, because the player population I have come across are injured players who has been referred by the doctors to me for the pre-rehabilitation prior to the surgery. So why they are being sent to the surgery before to the physiotherapy department is that they need to strengthen up the muscles around the injured area, so that after the surgery they would not be overloading their part of surgery. So in this, I even see players with pain and dysfunction also. Then after the surgery, these all the players are staying with us to just a minute. These players stay with us for 3 to 4 months for their rehabilitation, and then they are sent to the muscle strength training in the gym. But these players sometimes lose their confidence and they don't go to play again. As being a sports team member, like we have to motivate them and train them proper with the proper exercises. All this has to be done. Why I am specifying more about this is that the injury, the prevention of the injury is very important for the players. So I would strongly recommend that 70% of the injury can be prevented. With this, I would like to share very proudly about the player named Ashraf, who met with an car on accident, and both his legs were been amputated below knee. So I personally rehabilitated him in our department around 3 years, and he has been given prosthetics, that is artificial limbs from the prosthetic unit, and then we made him walk with support, and now he is functionally independent, and even he's with his lots of his dedication and hard work, he has become a para athlete till date. So even he plays wheelchair challenging basketball in Oman actually. So this information I really wanted to share, because this information would go to all players so that they will be motivated to do their activity even after they have an injury. So I would like to play a small video which has been sent by this athlete to me. This player who is I've been worked for a long time. He sent me this video, so I would like to play this video to just to see how his recovery has been. என்னோட வீடியோ தெரியல தெரிய மாட்டேங்குது. Sorry sir, I think when I make it into என்னோட வீடியோ தெரியல. நீங்க கேளுங்க. So I am going into the objectives of my presentation. What is sports injuries? The prevention of a knee injury by 4 strategies, case discussion, physiotherapy and rehabilitation of ACL injury, advanced physiotherapy management, exercise prescriptions for the muscles strengthening, and conclusion. So these are my objectives. So let us discuss what is a sports injury. As all of us know what is the sports injuries and how this has been happening. These are like a sports injury. It is always an unintentional accident happening in the field while playing. And maybe it is also due to poor training practices and improper equipments. And it's also an insufficient. Sometimes you don't warm up or do stretchings prior to the pre-seasonal. And then sometimes an overuse injuries due to excessive and repeated mechanical load, which causes all the tissues to get damaged. Okay, so this is the sports injuries. These are most common sports injuries, which all of you all know about this. as being a physical instructor in the player communities. Here, these are some of the common injuries like ankle strain, groin pull, maybe hamstring strains, knee injuries, spine injuries. So these may be due to some traumatic reason. Maybe sometimes they have an intrinsic factors and extrinsic factors also. Sometimes it may be very acute and sometimes it may be in chronic injuries which has been happening within this. So this is actually my main aim of this presentation is that prevention of injury by 4 strategies for the physical educators, trainers, and coaches has to pay more attention in this four strategies. So this will be helping us to mainly to assess the players, to prevent them from injuries, and so on. So let's start with, this is the foundation of the movement. I had given a topic as a foundation of movement. Basically, is all to prevent the knee injuries, not only the knee injuries, all the injuries of the players while they are playing. And this is the performance pyramid, the contributions of myofascial slings in sports, and examining lower limb muscle strength. So main thing here is the foundation of movement. The foundation of movement is, like, I would like to tell all the trainers and the physical educators, look for this, mainly the functional movement of a players. That is the A, B, C. A is the alignment to be good, and the posture has to be good. And B is the balance, supple, soft tissues. Control using correct muscles. Let me explain this with this is the alignment to be a good posture. So you could see the good posture here and also the bad postures. What is main important in this, that the good posture is always an the posture of the, not only the players, even the normal population has to have a very good posture like this. And this proper posture and the neutral alignment is a cornerstone of optimal performance of the players, the athletes. So in this, what you see is the athletes has a proper balance of muscle, of dynamic and static stabilizers. So what is dynamic is the muscle has to be balanced, and the static structure is also has to be balanced. See this is actually the bad posture. In contrast, here he is biomechanically inefficient, so that the poor posture will not help him to do his performance well, and has a risk of injury during their activity. Okay, and so we have to differentiate these normal good posture and the bad posture. Here some of the other thing where it is the anterior pelvic tilt and the posterior pelvic tilt. See this tilt, which is anteriorly, which causes the front muscle to be very tight, and the back muscle becomes very weak, for generally to be told. So what you have to do is you have to make the players or the athletes to stretch all these tight muscles and strengthen all these weak muscles. So this would be an very informative uh, part where you can prevent injuries from the field, and their progression and the performance level will be high. And this is also an posterior pelvic tilt. Fine. If this posture is normal and they are able to be in an alignment, you can just go to the balance, supple, soft tissues, in which tissues are always in supple mode. That means it is not so tight, it's not so stretched, and this might be causing an injury to the players, and the performance again has been disturbed. So the balance of this alignment of posture and balance of the tissues join together to use our correct muscles for the control. So when a player do run or do play, they have to use all their muscles correctly. So this is the main three important foundation of movement which we are seeing is ABC. That is the alignment of the good posture, balance the supple soft tissues, and the control correct muscles. Okay, so these things are the main thing which has to be noted. And now let's go to the now we are into a performance pyramid. See, this performance pyramid is another tool actually for making the players to perform well, and as well as to prevent injury. So this performance pyramid is what? Let's go from down below. These are the endurance, strength, power, and speed. So if suppose the players are being trained initially with an endurance, and then they go on with the strength, power, and speed. What happens if the athletes or the players directly quickly go up to the ladder of the power and speed without strengthening and endurance? They naturally tend to get injured, and naturally they get affected that their performance level is less. So on the whole, when we see this performance pyramid, what is this use of this is that it is very important that all the efficient of the movement that does not overload the musculoskeletal system. Understood? So this is the main pyramid of performance pyramid where we have to do is we are not going to load all the muscular system of the players or the normal individual, and this allows to move with less excessive force to our body and enhance movement. It is actually it is a prerequisite that we have to achieve this pyramid to move at the highest level. So this foundation of the movement is also into the from lower endurance, which is the training which has been given to the athlete with sustained period of time, maybe the low intensity exercise to high intensity exercise, then go to the strength. And I think this is really a known topic for all the physical trainers and educators to train your players in the right way with this endurance, strength, power, and speed. Okay, so in other word, I would like to tell that for walk, I mean to crawl before you walk, and walk before you run. Exactly. So this is actually a performance pyramid which is being formed to prevent an injury. So I hope you understand this. The next is of which contributes the myofascial slings in sports. Hope this is not a new terminology for our physical educators. This sling is nothing but a chain of muscles that work together for the integrated movement. See, for example, when you take an javelin player in this, the player actually has to run from the far, and he comes back to a place where he turns behind and try to throw. So there is a chain of muscles which is being activated during this moment. And what happens if there is no any sling system and you're not going to train according to the sling system is that athlete has to be trained for different kind of sport specific movement. It is not that just the athlete always do one type of movement. The sports specific, each athlete has their own sports, and each sports has their own specific movement. So what you have to do is you have to train them in such a way that the sling pattern of the muscles has been activated to do other performance. Why is because the performance is done in a multi-directional movement in a different plane. So habits or any injury which has been disrupted the link, that is the muscle in this chain, then the integrations falls apart and asymmetry begins to occur. So that is what always a physical trainer has to train, or the physiotherapists or the coaches have to train their athlete according to their muscle chain which is being activated. So in further slide, I will just explain how this would be. So for 5 types of myofascial slings are present in our body. So this is, for example, you take this anterior oblique sling. This sling has muscles. This is the yellow, is a, I have been highlighted this muscles in which these adductors is always working along with the your core muscles, and it goes up till the front chest muscle called the pectoralis major. So this, if any weakness or any insufficiency in this muscle might cause the performance of the player will not be as high as level. Okay, so the throw and the power and the speed would not be enough. For example, you take the same javelin thrower in which he has to have the front group of muscles to be activated, to be strong enough, and to move in multi-direction. These muscles has to be activated so that they can throw the javelin to a highest performance. So this is anterior oblique sling. So same thing, like this is very important, which I have put it in between, is the primary sling. This is the core muscle of everybody. Core muscle. It is not only for the athlete, even for us normal population who is sitting for a long time, who is not going for play and flexibility. These cores has to be very strong enough. The imbalance in this core also causes pain in the back, and especially for the athletes, this core has to be stronger to do a good performance of the movement. So the muscles are diaphragm, transverse abdominis, the back muscle is the multifidus, and the pelvic muscles. So hope you understand. So along with this, it is not only these muscles you concentrate, it you also concentrate on the core muscles, well as the primary slings. Next, let me go to this posterior oblique sling. Very important also. Why it is all the big muscles which is helping us to propel, to move. For example, I could even tell golf players, they have they have to have a very strong activations of these muscles which help them to propel and turn to give a force like that. So latissimus dorsi, gluteus maximus, and the TFL is very important. This sling is the posterior sling. And one more thing I would like to specify: it is not only on your right side; it is always a contralateral sling on both the sides. So if the performance of the player is less during this throw, you can assess them whether these type of muscles, these chain of muscles are tight or it is in sleep mode. You can activate these muscles by concentrating certain type of exercise. How the movement is specified for each sports activities. Suppose it is not only enough like you ask your players to always do squatting, lunge, and single squat. That's not at all enough. So what is we have to do is, I mean, the physical trainer and the coaches have to do is always the specific movement for their own athlete. What is the sports which they are participated. So this is again into a multi-directional a multi-directional way where they turn around, they rotate their hip, they rotate their trunk, their hand, and so you have to go in such a pattern to activate these slings. If these slings have been activated or this type of training is being given, naturally there is no injury happening to. You can really minimize the injury happening, and the performance would be higher than the one which he does. So there are again two slings, which is the deep longitudinal sling and lateral sling. This deep longitudinal sling, you could see again, this is the back muscles, which goes from the shoulder behind down, and these glute muscles, and down you come to as in hamstrings, and it ends with your leg. This is also a longitudinal sling where you can activate this pattern of exercise, or the extension type of exercise, so that this will also help them in propelling. And about the lateral sling, of course, this is these muscles, for example, if I tell these muscles are weak, suppose the adductors and also the gluteus behind back muscles, this causes a static instability for the stabilizers. I mean, the structures within the joint, like the ligament, the bone itself move, the valgus deformities, they tend to keep their knee in front, and this causes again the stress to the knee joint, and this might also causes injury to the players, and the performance also will be affected. So we would train our players in such a way with all these sling patterns for modifying their movement pattern of games. Okay, so hope you all understand this. You can just post it if it is not understood. Yes, see, this is the fourth strategy I would like to tell you. A very simple drop jump test to strength, to just examine your lower limb muscle strength. Even the players themselves can assess. You can ask the players to stand on the small bench and jump down. So you focus more on the eccentric type of deceleration and just hold it for 3 seconds. So you see if your knee is coming in an incorrect position, that is the knee is coming in front, each time when you jump, it shows that all the dynamic stabilizers, that means the muscle which is inside, the muscle which is on the outer part, I mean your adductors, your glutes, all are weak. As I showed you in the sling, when these muscles are very weak and it is not activated, this happens. Got it? So this comes into valgus stress for the knee joint, and any injury like a ligament injury or meniscus injury happens into the knee joint and they get pain and all. So this would be a correct posture. And this is also an exercise where you can train them to keep their leg out during the squatting. So if the athlete has more valgus stress, dynamic stabilizers are weak, which causes more load on static stabilizers to get injured, because the athlete has to perform multidirectional movement like running, accelerating, and rotating of the joint. Same thing. He has to turn around, he has to kick, he has to sudden rotation. All movement will be more concentrating on the muscles which is present around the hip joint, the knee, and the leg. Yes, and let's go to the other examining lower limb muscle strength is squatting. A very simple. You ask your athlete, our player can stand by themselves on the near the wall, squat to 90 degrees of your hip to be 90 in position and your knee in 90 position, and ask them to hold it for 60 seconds. And you can see what are the muscles it's been activated here are the quadriceps on the top, the hamstring, and the gluteus muscles which is behind is being activated, and you could feel that stress on that joint muscles. And if it is really very strong enough, you can go for another progression of exercise like lifting up your leg. So you hold this leg for again 30-60 seconds, and you feel that you are very good, and if you don't have any an imbalance or a shaking of your leg, then you can go with a single leg squat. Okay, and then you can hold it, and still you are strong enough and stabilized, then you have a very good dynamic stabilizers preventing your knee injuries. So this is some of the simple technique where you can find all your athletes, whether they are having a proper balance of dynamic and static stabilizers. That is the muscle, and the structure outside is the ligament and the bone, and everything is being strong enough for the players to do their activity. So this is the 4 strategies which I spoke about you to prevent the injuries, mainly As far as I would strongly recommend that 70% of the injuries can be reduced with all these four strategies, like the foundation of the movement, like seeing for the ABCs, and then the performance pyramid where you correctly go according to the pyramids. I mean, the ladders, the endurance, the strength, and the power and the speed. And then coming to the sling system again, following the chain of a pattern of movement, all these things. And these tests, like to just for the checking of this balance of the muscles, when you are concentrating more on these type of exercise prior to the event, or training players for the event pre-seasonally itself, they would really prevent them from the injury which is going to happen for them. So these are the four strategies. A small case discussion I would like to tell here is that I am taking a basketball player who plays in a junior and senior championship, and a very active and accomplished player. The player always complains of pain developing in his knee for 2 years. The progression of the pain is going on, troubling him that he's not able to do a landing, running, pivoting, rotational movement. And this pain is really nagging him so much. What happens? Maybe he has an imbalance of muscles, or there is a daily basis micro injuries happening on the knee joint, and then repetitive strain, and this might be causing him swelling and pain, but still he comes to play, he completes the play event, and this goes on for a period of time. What happens? He might be going to the doctor to the for the treatment options. So he might be taking a rest to reduce the inflammation. Then he goes to ultrasound therapy and physiotherapy department. Maybe this reduces his spasm and good flow of blood. And then circulation is good. And then sometimes he takes a steroid injection where the inflammation is reduced. And then again he starts stretching and small strengthening exercise. And then again he returns to play once the pain is lessened. What happens without addressing all these imbalance, these alignment, their foundation of the movements, and the faulty pattern of the pattern of movement? When if he has all these things and taking all these type of treatment, in spite of taking treatment, again when the player comes into play, he mechanically overload on the tissue, and again there is a tear or an injury reoccurs for the players. This is what I wanted to insist more in this. Each time when they have pain and a problem, they go to the doctors, do all measurement, all the ultrasound and all these being taken, and when they come again there is a recurrence of the pain. So how to avoid is that to look for the foundations of the movement patterns. Got it? So now I would like to go into physiotherapy and rehabilitation of an athlete after ACL injury. Here I would like to tell a very quick anatomy and the function of the ACLs. So this is our thigh bone called as femur, and here is the tibia, and you have the ligaments around the joint, which is the static stabilizers, like anterior collateral ligament, cruciate ligament, posterior cruciate ligament, medial collateral and lateral collateral ligament. And then here are the dynamic stabilizers, the hamstring muscles, the quadriceps muscles, and the tendons which is around. And even the nervous system also provides a dynamic feedback for the stability. So this is the biomechanics of the anterior cruciate ligament. See, during extension, the ligament is like this and normal, and during flexion, the ligament inside the. So the ACL, the anterior cruciate ligament, has a main four function. One, it retains anterior translation of the tibia. The tibia is not being moved from the femur. It always holds. And the next one is that it doesn't give a hyperextension of the knee. I mean, the knee doesn't go behind, and acts as a secondary stabilizer to stress and reinforcing the medial collateral ligament. So controlled rotation of the tibia of the femur in a femoral extension of 0 to 30 degrees also is, all these activities are being maintained by the static stabilizer, the ACL. This is the biomechanics. And now we have come into a common mechanism of the knee injury. Anytime you see the injury, how does the injury happen while you are playing? So these might be some of the mechanisms like for ACL. You can see again the leg is going into valgus. See, when there is a hit, your hip has goes into internally rotates, and then there is a valgus stress. I mean, the knee is bent little and they get landed down. So this again causes the stress to the ligament, and there may be a partial or a full tear of the ligament happens in the knee joint. So naturally there's some signs and symptoms. Mainly there is a swelling. You could see here the swelling. Sometimes they have a very deep pain, and instability occurs when they are walking later. They feel that their knees is going to medial and lateral, and there is an instability. And when it becomes chronic, then they have a pain and giving way of the knee joint. And this range of motion, that is the bending of the knee, would get lessened also due to pain and swelling. So these are some of the tests where doctors and we do to find it out whether they have an ACL tear. And now I am coming here to tell you how to fix an ACL tear. See, ACL is a ligament and it does not get healed by itself. Either it has to be repaired or reconstructed, because as far the ACL has, there is no any blood supply inside the joint for the ligament, so it has to be repaired to keep the femur and the tibia into an alignment. Then improving the dynamic stabilizers like the muscles around the knee joint so that it is being stable, kept stable. The non-surgical approach, I would more insist on the non-surgical approach. If the patient is, I mean, the players has an less injury or a partial injury of the knee joint, all the joints in our body has an alternating pattern between the functions. I would like to tell you an information on this picture. You could see a mobile and a stable. Why I've given this is that when a player or a person stands, you can see some of the joints are moving and some are unstable. So like these toes are mobile where the midfoot is stable, ankle is again mobile, and knee is stable, and the hip is mobile, and it goes on. So if suppose anything, the mobility has been restricted in hip and ankle, will naturally stress the knee joint. So you need to just check for the hip muscles, hip rotation, and the ankle joint, how it moves. Sometimes if he has any deformity or default positions, like the foot is getting pronated, sometimes he's a very flat foot, and his muscles are weak on the intrinsic foot muscles, and you're not going to strengthen these things, it directly, the stress is directly going to the knee joint where the knee is getting affected. It is not only that the knee is directly going to get a hit there and there is a rupture. It is not like that. It might be due to the hip joint, where the hip joint is not mobile, where you have sometimes tightness of the hip stabilizers. I mean, the muscles around the hip joint, and your joint itself doesn't have good rotation. So these are all the causes of knee stress, and this is the cause of the injury happening into this. And I would even like to tell all the physical trainers and the coaches, if if the player has any problem in any particular joint or in any particular area of their musculoskeletal system, it is not that they have to sit in the home, take rest for a long time, and not coming into the play, not coming into the field for anything. This is this really demotivates them and they get depressed. So I would like them to be put into a rehabilitation team where they are you focus more on the apart joints. For example, if this knee is getting stressed, you can focus on the hip muscles, your core muscles, your hand muscles, and your trunk, and for the other leg, and for the leg and the ankle. So you can do some of the dissociation movements for all these whole skeletal system, so that the load happening, the stress happening to the knee joint will be lessened. So when, if he is going for a surgical procedure or non-surgical procedure, he would be better even after the time of I mean, like surgery is done and he's been waiting for 3 to 4 months. By the time, all the joints and the muscles will be flexible, and there will not be a more mechanical overload on that particular place, and then he can come to the field for playing. So hope you understand. And this would be the goal of 4-phase strategy for injury recovery. It's mainly by the physiotherapist who really who concentrate on this: the relax phase, reset phase, restore, and reprogram. These are the recovery phase where we more concentrate. We have our own protocols, what to be followed. And when an injured patient, the ACL recovery, I mean ACL reconstructed patients, and those who have a partial tear are all being treated with all these relax phase, reset, restore, reprogram. Here, like in relax phase, we give ice and some of the tense, and pain has been released, and mainly we start with an isometric exercise immediately after the surgery, and lessen the pain. And then we go on with the reset, where we activating all the muscle. As I told you, the knee, hip, and foot muscles have been activated, and mainly concentrate on vastus medialis obliquus, which is the knee muscle, which is the quadriceps muscle. This is the very important muscle which gets weakened immediately after the injury. Even you could find it, there is so much weakness that atrophy happens, and they are not able to extend their knee, they are not able to lift their knee up because of these muscles. So you have to activate these muscles, and the glutes, and the foot muscles. So more focus on the joint for mobility and stability also. So you make them bend. We need a full bending of the knee joint. It should not be stiff later. So we concentrate more on resetting the muscles. And here again, the restore, the balance training is being given. We are going to achieve the range of motion. I mean, the full bending of the knee joint, and the kinesthetic sense. I mean, like, you know, each joint has its own sense. So this is mainly trained by the physiotherapist, and you have to be trained mainly because a recurrence of injury happens if this kinesthetic sense on the joint is not being trained. So that is what we put them in both ball, like balance training, where we give that they focus on the joints. And the reprogram, again, here the brain and the body comes together, integrating a new functional pattern. This is the PNF exercise, the same exercise like balance training. And athletic specific movement and multi-directional movement is also being concentrated by the physiotherapist. So here is in some of the advanced physio management what we give them. It is it's called as a cupping therapy, kinesio tape. Tape, of course, you all know about this. This is the dry needling. A small tennis ball. You can use a small tennis ball to release your trigger. If you have a very trigger point for a long time, one particular place of pain in the muscles, you can just rub it on that, so that the mechanoreceptors work, and the sliding of the muscles happens. It becomes loose little, so that will be really helping you. This is an IASTM. This is an instrumental assisted soft tissue massage. You know, mobilization is also done with this. Here is a small instrument where we keep it on the muscle to give a stretch, and this is also activating the mechanoreceptors which is on the top, and this helps in relieving the tightness of the fascia which is on the top of the muscles, I mean under the muscles. And this is again the trigger point to release. And you can use a foam roller, of course all of you know. You sit on that to do a movement where again the tissues are getting a little bit loose. And then this is the flossing technique where we stimulate the mechanoreceptors along with the fascia. We do this flossing movement. So these are all advanced physiotherapeutic management uh, at present. Recent advanced research has been done, and these are advanced physio management what we do in our sports unit. So these are the exercise. So see the VMO activations of the knee muscles, knee exercises. So these are the type of exercise. Hopefully all of us know how these exercises have been doing. These are some of the glute muscles strengthening, even this squatting, and then this is a balancing exercise, very important for balancing. These are some of the exercise. Again, strengthening all the abductors, all the glute muscles, agility training, single leg squat. So these are some of the exercise according to the protocol, and we make the players to, I mean the patient as well as to go according to the protocol, and then they will send them to the gym for the muscle strength training. Again they come back to the agility training to back to us, and on field management they do all these things. So this is how you rehabilitate an ACL injured patient. The core of my own presentation which I have given you is that prevention is always better than cure. So you start doing the foundation exercises for the players, that would be really helping them in getting a very good performance, higher performance level to be attained, and the injury would be prevented. So this is my conclusion, in which as a physical trainer, coach, and physiotherapist has to really identify the sports specific movement pattern and follow the performance pyramid, like the endurance, strength, power, and speed, and train the athlete with the correct foundation of the movement under supervision. Supervision has to be there. It is not like you go just do and I do my work. No, you concentrate them, see to that they are working it in a correct manner, and they use a proper muscle. And if they are going to do, if they are going to do exercise in an improper or incorrect manner, again there is no use of training them. And then activating the sleeping muscle, strengthening the weakened muscle, and stretch the tight muscles. So then the train the athlete sling mechanism for the multi-directional movement, and the proper protective aids according to the sports. So these are all to be concentrated and to be seen by the physical trainers, educators, the coaches, and physiotherapists for each individual. So this basically, this foundation of movement is even for us as a normal person sitting in front of computer for a long time, driving for a long time. Your foundation of movement is also going to get weakened. So we will also do exercise in this lockdown period, and build our immunity as Dr. Whalen has told us. So by this I would like to end my presentation. Thank you.
Thank you, ma'am.
Thank you so much.
Thank you so much, ma'am, for your
Thank you,
wonderful
sir.
presentation. You are
Thank you, sir.
most apt and resourceful resource person, because it is we can able to know from your presentation. You are more, you are what a great explanation, ma'am. And all the pronunciations are very perfect. All the technical terminology pronunciations are very perfect, and we enjoy it. And your presentation showed your experience as a sports physiotherapist. I can able to understand your experience. I can able to know. And also you explained all the ACL, PCL, LCL, MCL, and even advanced physio management also you have explained very well. For your information, during our master degree,
Yes, sir.
we had a sports medicine paper, even in BPED, sports medicine paper,
Yes, sir.
and even the rehabilitation and everything we will study. But in a little bit, in overseas only we have seen, we have studied, and we have gained little bit of knowledge. When you explained all the matters, we can able to realize where we are. And now we got more interest to learn about all the physiotherapy aspects. Thank you so much, ma'am.
Welcome, sir.
Yeah. So, dear participants, do you have any questions? You can come into the chat box. But don't put a good afternoon, good evening, good session ever. Please post your only the questions. We can have 1 to 2 minutes to answer. Do you have any questions?
Hope questions are not there.
Yeah,
Maybe maybe
No,
they
no.
don't understand, or they had
No,
understood
no,
everything.
ma'am, no. Actually, I have closed that chat box, so
Okay.
that only because during your presentation, then and there it will come. So that only I have not opened that chat box. Dr.
ஒரு
Veeramani,
கொஸ்டின் வந்திருக்கு.
yeah, Dr. Armani Veeramani has asked one question, ma'am. How far kinesiological taping in acute injuries?
Can also see acute injuries can also be given the kinesiology taping we put for the patients in an acute injury. It also helps in draining the fluid. Generally, lamely, when I tell, the fluid which has been present inside is also being drained when a tape has been fixed in such a way that it pulls up the tissues, and they have a space in between so that it gets drained. Even the patient with an acute pain, when they have they come with a shoulder pain and they have a little tendinitis over there, we try to put a tape of like a start and position on that, so that this really pulls up the tissues which is present on the top, so that the healing mechanisms would be good for the patient. So you can do that taping.
Nice, thank you. Okay, ma'am. Everybody, they are expressing all their good words to you. How to manage ACL injury occurs in the match? Is there any first aid, ma'am?
So, yeah, yes, I actually missed the topic. If the patient has I mean, when the players are playing in the field and all of a sudden they have a pop sound and immediately they're not able to move their knee joint, and gradually there is a very big swelling, immediately the player has to be shifted with ice and has to be referred to just check whether they have ACL tear. Immediate on spot, we are not able to do that test exactly. So all the injuries which has been happening in the field has to be checked that it is not. It's if it is just like an acute injuries like the bruise or cut or any strains and little bit they become alright, they can again go to play. Otherwise, it would be better to get referred.
Thank you, ma'am. So many questions are coming. I will inform them because the time we have a short of time. Already the time is 5:21. So I will inform them that I will provide the email of you.
Sure,
And
sure, sir.
yeah, they will get the good and relevant information from you, ma'am. Thank you so much for your
Thank you so
nice
much.
and wonderful presentation, ma'am. We are
Thank
so
you so
honored
much.
with your presentation. And as an organizing secretary, it is a formal part to deliver the vote of thanks today. And at the outset, I'm very happy and thankful to our Vice Chancellor, sir, for giving this opportunity, for permitting us to conduct this international webinar on recent advancement in research. And also, I thank our beloved registrar, sir, for his permission. And the person who are always behind us is our Dean, Dr. Jnanadevan, sir, Education, Faculty of Education, who has inaugurated this seminar yesterday. Dear participants, I wanted to tell one thing. I forgot to mention one thing. Yesterday itself, our resource person, this is Vijay Sindhil Kumar sir, ma'am, has attended all the sessions yesterday itself. She was there and she was listened all the sessions. So, as from the organizing committee, thank you for your participation, ma'am, for yesterday's participation. And outside, we also thank our Professor and Director, Dr. P.V. Selvam, sir, who always believe us and who always give to all the works in any sort of time. And also, I want to thank today's most resourceful resource persons, Dr. Sengutuvalan Murugan sir, and also Mrs. Vijaya Sindhil Kumar ma'am, for their wonderful presentation. The first Sengutuvalan Murugan sir has eradicated and has given more awareness with COVID-19, and you, ma'am, has given more awareness to learn more about physiotherapy part. And so we are so honored to have you as a resource persons. And also I thank Dr. S. Arul, co-organizing secretary, who has delivered the welcome address today, this session, and who is behind with me at always. And at last, I want to thank our University Innovation Center, who are updating all our webinars details in our website. So once again, I thank all the participants and also all the resource persons. Thank you so much. Thank you. Dear participants, for you, a small instruction for you, don't ask in a feedback attendance form and feedback form in the chat or through WhatsApp group. Based on the attendance in the Zoom, I will send you through mail. Within this, within 7 p.m. today, you will get it. So you can have that attendance form. You can find the attendance form in your mail. Thank you so much.
Thank you, sir. Thank you, Karthikeyan, sir. Thank you. Karthikeyan, sir.
Yes. Thank you. Thank you. Yes, it's finished. Yeah, one by one they are leaving.
Karthikeyan, sir.
Yes, yes.
Karthikeyan, sir.
Yes, yes. I can hear you.
Okay. Okay.
Salum sir is there.
Inform to Sedu, sir.
Salum sir is
Shall I now?
PK.
there. Yeah, fine. You can end the meeting.
Sir, shall we send out?
Yes, yes. No, no.
Enough. Thank you, Sedu, sir.
Thank you. Thank you.